in the east of Kerala, New Delhi. So I'm here to talk to you about the newborn babies, how they are looked after once they are with the mother. The first important thing is there has to be a good relationship between the baby and the parents. Your healthy relationship helps in healthy mental well-being of the baby as well as the physical growth of the baby. This is very important aspect of all children development up to the age of psychologically fully developed healthy baby. So there are a few topics which we want to really talk. As a newborn baby, the first important thing is the bathing technique of the baby. In the bathing technique, you see, we need to look after how the babies are given wash. The first few weeks, the babies need only sponge water. Infant needs only sponge water. They do not need with the water immediately, just putting the baby inside the water. The warm, damp clothes, which is dry, just needs to be mopped around the baby. The face, you can just put little water on the face, clean the face, underarm, sides of the thigh, creases, and just do the dry mopping. Before putting on the diaper or the nappy, make sure the areas, the creases are dry very much. Otherwise, the moisture remaining in that area leads to develop rashes, which is the potential source. The sponge should be for a very short time. It should be done within 3 to 4 minutes so that the baby does not get upset about that. Make sure that the temperature of the water is at the room temperature, which is not very cold, which is not very hot. Okay. At the same time, the umbilical cord, that area need not be, stump should be left dry. It should not be wet a lot. Make sure that the water does not go into the eyes, ears of the baby. This is what we do to the sponging. The sponging can exist till 3 to 4 weeks. There is no problem with that. Umbilical cord usually falls by 5 days to 15 days, maybe sometime 20 days. Till that time, you should make sure that you are sponging your baby. The first incidence once you start doing the bath, the baby gets a little scared at it. But yes, slowly and steadily, with a wet hand, when you start touching your baby, the baby realizes and baby is more comfortable. The bath is usually done with the water. Soap you can use mild soaps with a pH of 5.5. That can be done. Initially, what you can do is you can make the baby little inclined, putting your left hand under the shoulders with the thumb supporting the neck of the baby, and with the dry, wet cloth, you can just sponge the baby. Make sure that when you are giving the bath to the baby, the water inside the tub has to be hardly 2 to 3 inches total, so that it does not come over the body of the baby on the floor. Mild soap, I've told you, the pH is 5.5, and after that the dry mopping has to be done. Make sure when you dry mop, wrap around a soft cotton towel which is not causing any roughness to the skin of the baby, because the skin is the sensitive part. Before making the baby wear the clothes, make sure that all the areas of the skin is dried out very well, especially the diaper or the nappy area. Well, the most important aspect is the breastfeeding. To all the new mothers, I would suggest initially they should spend little time, or the expecting mother, they should spend little time with the sister in the nursery, talk to your doctor, positioning of the baby, how to feed the baby. Once the baby little technique has been taught to you, the ideal is make sure the baby is little inclined, with the head facing the breast. With these index finger and the middle finger, you need to stretch apart. Go inside the mother's breast. Try to push whole or the 3/4 of the areola inside the baby's mouth. With the baby is in inclined position, that space, that space provides the baby to breathe easy. Babies, they have a tendency to go to sleep when they are working upon the mouth. In that condition, with the middle ear, you need to stimulate the chin of the baby so that the baby is up and about. Ideally, the baby needs to work upon the mother 15 minutes each side, followed by the burp, and then the babies can go to sleep. It is the which comes to the baby when the baby works for 15 minutes upon to the mother. Well, the first milk is the colostrum, which is a thick yellow color fluid. It is rich in so much of antibiotics, you can say, helps the baby's intestine to kill up the microorganisms. So these things are very important. So do not let that colostrum go waste. It might not be very big in quantity, it can be very small, but that small quantity, trust me, is good enough to fill the tummy of the baby, so that colostrum becomes very important. As I have told you about the feeding position of the baby to the mother, make sure that the whole of the areola, 3/4 to whole of the areola is inside the baby's mouth. If the baby tends to work upon the mother's nipple, the baby latches upon the mother so firmly and stimulates the mother so firmly that it causes cracks in the nipple of the mother, and trust me, that's a very painful state. Then you won't be able to continue with the breastfeeding. So positioning becomes very important. I think with the breastfeed we have done, let's go to the how to soothe a baby who's crying. You see, there are very few things what makes babies cry. So we should not get very complicated. Babies, they have a tendency to ask, is my child having cold, or what happens if I give where there is a colic into the tummy of the baby? Why would the baby might cry? So what medication should I be keeping at home? Ideally, we shouldn't be going into that. The best way is there are 3 to 4 only good reasons why the baby cries. The first foremost is definitely the baby is hungry. The second is the baby is wet himself, either with the poo or the pee, or the third is the baby has got some discomfort. Since it's a summer in the northern part of the India, trust me, if the temperature of the baby inside the room is not maintained, that is a big reason right now that makes the baby cry. So the summer clothes has to be there. 1 to 2 layers of cotton is more than enough. Maintain around 25-26 degrees inside the room. So first thing, if the baby is crying, you should look for the baby is hungry. Try to put the baby to the mother if the baby is hungry, and if there's a little more time than normal, then baby might take a little more time to latch upon the mother. So keep crying for a while. The second important thing is babies have wet himself. So look into that. Once you dry up your baby, the baby gets the comfort. The third thing, which is I think is one of the important ones, is if the mother can put baby to skin, that gives the baby the confidence that I am attached to the mother still. That hissling sound is there when the baby is inside the mother. That sound should be there. You can talk that sound to the baby. That makes the baby feel that I'm still inside the mother, and then that puts the baby to the comfort zone. Skin to skin is very important. If you can do that immediately, that helps. But there are small things also, like putting the baby onto the shoulders, patting the back, or you are just rocking the baby for a while. That also soothes up the baby. So the important thing is feed, wetness, skin to skin, and whistling sound from the mouth that helps the baby to soothe out immediately. Well, this is the question which we are asked quite often: massage. You see, massage is a very important thing. All babies in the initial first few weeks do not need massage, but yes, after that they need massage. That helps the babies, they are relieved, the colic is reduced, and then they go to sleep. Once they are tired out, they go to sleep. You can use any good oil, that is good enough. But the oil should be used in a manner that it should not wrap around the baby. 2 drops of oil for each limb, 2 drops of oil from the front, 2 drops from behind, that is sufficient. So 10 to 15 to 18 drops is more than sufficient for the baby to be massaged with the oil. Any good oil I would prefer. It could be a coconut oil, which is very good, trust me, it's very good. And now the technique of massage. Technique of massage is, you see, you need to just roll your fingers onto the baby when you are massaging. And you should not give a dry massage in this form so that the baby does not feel pain about the massage also. Once you are done with the massage all over the body, just wrap your baby around a dry cotton towel and then try to give him a pat, and by this time the baby is tired and baby needs to go to sleep. Advantages of massage, I told you in the beginning that it makes the baby tired, so the baby feels sleepy more, sleeps better. Once the baby sleeps better, baby is more relaxed. Once the baby gets up after the sleep, the baby is more comfortable, baby has burped well, so the baby looks more contented. And that also helps to mobilize the joint of the baby, and at the same time helps the babies to pass the whole gas. Well, the skin to skin or the skin mother's hand to the massage also helps in bond development within the baby and the mother. Baby positioning and burping. There are 2-3 methods you can make a baby to burp and the position. The most ideal is, you see, you need to put your baby onto your shoulders. Make sure that the tummy of the baby is not pressed against your shoulders. If the tummy is little below your shoulder or little above your shoulder, that's fine, but it should not be just against your shoulders. And you need to pat the back of the baby, that is just behind the lower part of the nape of the neck. Little patting is required. This is the first one. Second method, which is more encouraging and easy for the mother, is mothers, they can always squat on the bed, sit down and put the baby's head on one side, right or left, facing down onto the lap of the baby, lap of the mother, and the tummy and the legs are in between the two thighs of the mother. Make sure there is a gap between the tummy and the mother's thigh and start patting the back of the baby with the right hand. With the left hand, fix the head of the baby onto the mother's lap so that the baby does not get upset about it. Try this out method. It is very easy and it is very encouraging, and much more confidence you gain it on the first one. Not necessary that with the when you are burping, trying to burp the baby, that you hear the burp, but there are enough burps which the baby would get so that the baby goes into the comfort zone. It should be done. Initially, I told you that the 15 minutes is required for each side of the breast. So with each side, you burp your baby and then put the baby into the next side of the mother. Clothing and wrapping the baby. See, it depends upon the environmental temperature, the number of clothes is required. Inside the mother, the baby is maintaining a temperature of 36-37 degrees Celsius. So the nature has not provided any to the baby. So when the babies are out, make sure that the temperature is around 25 degrees Celsius of the room, of the environment, whether it is a January month of the North India or the June month of the North India. But the room temperature has to be around 25 degrees Celsius. If the room temperature is 25 degrees Celsius, cotton 2 layers is more than enough for the baby. A legging of cotton and a cotton banyan and a cotton shirt. That is more than enough. If it is a winter time and you are not able to maintain the temperature, then definitely you need a cotton cap. Also cotton mittens and cotton gloves. No fancy clothes with lots of logos, zip, embroidery. This is required. They need plain, simple cotton cloth and a langot, Hindustani langot that works. Well, the potty. Yeah. Initially, first few days, the 3 to 4 days, the potty color keeps changing from dark blackish to greenish to yellow to golden yellow in 5 7 days. This is meconium is changing after from black to yellow. Once becomes golden yellow, it is the milk potty which is coming. Initially, you can see any of the human babies, they are passing lot of motions in a day. As soon as the baby starts working upon the mother, the baby tends to pass the little potty. This is known as gastrocolic reflux. This is normal. We do not try to overtreat this, which contains little amount of potty and little more amount of water. And well, as the day advances by around 6 8 weeks, you'll see that the baby is having motion in once in 3 days, 4 days, especially if they are totally on the mother's feet. Even this is normal, even that is normal. So these are the normal variation. So there's nothing to worry with the body of the baby. Do not get panicked unless the purge rate or purge rate means if it is number is more than 10 to 12 per day, the volume is more of water and the child is little lethargic or not sucking, that is a point of concern. You should immediately contact your doctor. Well, as you know, the mother's feed is the best. Well, if the mother is not having feed, there are few of the formula feeds which are US standards, FDA approved. So you can go for those. You can ask your doctor, he'll tell you which formula feed is good. That's all. My babies, the next thing is what would be the state of potty when my baby is on the weaning? Well, it depends upon what type of food you have started. But it is a soft form stool. Weaning has to be around 4 to 5 meals in 24 hours. With this, you can see 2 times in a day, easily baby point. That's not. Well, the next important thing is about the diarrhea. Diarrhea is a running loose motions where the purge rate is high, more than 7 8 per day, 5 to 6 to going up to 7 8 per day. And if the volume of the water is more, then definitely that is a diarrhea. It is a gastrointestinal infection of the baby. Usually babies they get in the bottle fed or they are provided with the soothers, or when they are about to they are on teething, or when you start solid, then they have a tendency to put things in the mouth. That is the age when the baby gets diarrhea. There are two types of diarrhea. Usually we see that the viral and the bacterial, and there are a few more which has got different reasons for that. You should definitely visit your doctor if the pulse rate is high. Viral diarrhea, they have got tendency to subside by 5 to 6 days. And bacterial diarrhea, if the stool shows infection, you need to add antibiotic. Ask your doctor about that. He'll tell you better. The next important thing about the gastronomy is the constipation. Definition of constipation is a painful hard stool. Usually babies, they do not get hard stool, they have got a formed stool. Mothers, they come to us and complain that doctor, my baby is having constipation. When you elicit the history, you find that it is not a hard stool, it's a formed stool, but the child is putting pressure. Well, you see, that is not a constipation, that is only a formed stool, but the child is not in a state where he can hold upon or pass upon potty as per his requirement. So when the rectum gets full and it is exerting pain onto the baby, then the baby has to open the anal canal so that the child can pass the stool. If it is really painful and the child is crying, it has to be seen by the doctor. There can be some local anal problem at the anal site. So that has to be looked. That has to be looked. It can be a small cut, you see. That cut has to be seen by the doctor. Apply some Vaseline and all so that it moistens out. And if the doctor needs a local antibiotic can be applied. Well, over the years, you see, we have heard that teething is a major milestone of the baby. Well, we doctors do not consider it to be a milestone, bigger milestone, but at the same time, teething is a problem area of the baby. Initially, you see all the babies in rest of the houses, when they go for the teething, they have got lots of problems. They are associated with the loose motion, diarrhea, as well as at the same time there can be little irritability, uncomfortability. The little more than normal, you see the baby is little upset, little more than normal the baby is cranky. So those are the things associated with the teething. It is not the teeth eruption which is the problem, it is the teeth formation inside the gums is a problem. So when the teeth is getting formed inside the gum, the child has got a tendency to latch upon a mother's shoulder and put hold of the pollen inside the mouth and trying to chew. Anything which the child can latch upon, holds it and tries to put in the mouth and chew. So that is one indication that the child is under teething. There are some problems associated with the diarrhea I told you, but yes, there are incidences of the cold cough running nose also increases with that. If the child is suffering from any such thing, you should once visit your pediatrician. Well, the vaccines. You see, vaccine is a very important aspect of the baby. It is a preventive method to prevent the baby getting infected and getting treated. Now we have vaccines for almost good number of diseases which we see with the babies. So my advice is strictly follow your pediatrician, go for all the vaccine. You might talk to your doctor telling the doctor this vaccine is it compulsory, this is optional or non-optional. See, these optional and non-optionals are the condition which is put by the IAP to see the affordability or the non-affordability. But yes, there are in the developed world, all these injections are made to be given. So any injection which can prevent your baby, why not? So kindly go for all the vaccination. That is very important. You can ask me, there is a schedule which is strictly followed by all the doctors, which is either by me or anywhere from Jammu to Kanyakumari. It's the same. It is all over the globally same. Small few weeks here and there, 2 weeks here and there can be the difference. Nothing. When do you want to start the solids? This is one thing which is of my concern. I really enjoy my mothers telling how to wean your baby. You see, the important thing is once the 4 months gets completed with the 5th month which is started, this is the best time. The early you start, the early the child gets latched upon the food and the better the child is. 4 completed months, 5 months plus may you can start with a top meal with juices and soups. This is the best time. Salt and sugar needs to be avoided till minimum 10 months age. Because we are a tropical country, salt is not required that much. 1. 2. Initially, the number, if you see a newborn baby goes for around 8 to 10 feeds in minimum in 24 hours. By 5 to 6 months, they are around 8 to 9 feeds in 24 hours. So, out of which 5 to 6 we want to wean and 3 to 4 we want to give to the milk. and preferably the milk at this time also should be the breastfeed, and the solid is 5 to 6 times minimum. Initially you can make it in the clear soup forms, 5 to 6.5 months, then little thick consistency, then further thick consistency. By 9 months you can give anything and everything which is hand mashed inside the gravy food you have made, and start feeding your baby with the katori and chammach. That is the best. What all to give? Try to avoid till 9 months eggs, and anything which is allergen, you know it in the family running, then you avoid it for a while. Those things are must. What to start? If you want to know that also, then you can go for the rice cereal, dal water, rice water, fruits, bananas, apples, vegetables. You can do it with anything and everything. It depends upon the age of the baby. If it is 5 to 6 months, it should be in the clear soup. 6 months, it should be little thin in consistency, much thick in next month. So keep on increasing the consistency. By 9 to 10 months, anything and everything hand mashed, and with katori and chammach is fine. Try to bring the baby onto the common kitchen food without adding salt and sugar till 10 months. If you try to cook for your baby individually, initially baby would definitely appreciate it and love it. But as the time passes, the baby is interested in your food, not in his or her own food, because your food has got taste and his food is rich but poor in taste. So the baby wants to have that. Idhar aana. Thank you. Anything, if you want to talk to me, you can talk.